Bismillahirrahmanirrahim. I am your instructor, Dr. Arbu Jameel. Current trends in biochemistry. In this course, we study different types of diseases, disorders, and the recent research in the field of biochemistry. Today, our first online lecture about the anxiety. Anxiety is a disorder which is related to many type of diseases. It is actually related with other diseases which can be cause the anxiety. First of all, we talk about what is anxiety. Anxiety is actually an intense, excessive, persistent worry and fear about everyday situations. Situations like social behaviors, any type of trauma, any type of accidents, any type of sudden conditions, any type of illness which leads to the disorder of hormones which can cause the anxiety disorder. Although it is related with many of the symptoms, but the main symptoms of this anxiety disorder is shortness of breath, high pulse rate, sweating from the whole body, fear, and feeling tired. Feeling tired means we are unable to do the daily life activities. It's very difficult to handle this situation if it persists long and remain for many days. It can, the anxiety disorders, the anxiety attacks may be of only 10 minutes, or it may persist for many days, weeks, or even for months in certain conditions. Anxiety is very it is not a very excessive disease which can cause death, but the patients feel during these anxiety attacks that it may lead to death and they die at certain. But this is not leads to death. This is only a certain type of condition due to the imbalance of different hormones within the body which cause anxiety attacks during the unhealthy conditions of the patients. Let's talk about the different types of anxiety. Anxiety is of different types. First one is the generalized anxiety disorder. Generalized anxiety disorder. This is actually the main and leading anxiety disorder which is caused by other diseases during the disease conditions. For example, in case of cancer, in case of diabetes, in case of any epidemic conditions, the patients feel anxiety, they have the fear and worried about their health conditions. So it may lead to anxiety also. Worry and fear situations may be caused by a lot of things in mind, which is thoughts comes into the minds. So this is a very common generalized anxiety disorder, and it may be for 6 months or maybe more than that. Second type is social anxiety. In this second type, this is due to the social behaviors. Social behaviors like the criticism, embarrassment, and humiliated by the other persons may cause the social anxiety. Person's personality crash also leads towards the social anxieties. Social behaviors with each other can cause the social anxiety in the persons which are of lower orders, or maybe due to the high rich persons to be they meet, they cause them criticized, they embarrassed them, they humiliated them. So that's why they feel social anxiety in their minds. Third one is the specific phobia. Specific phobia. This is also the type of the anxiety. In this case, the persons are fearful about the specific objects or for the specific situations. If these situations are occurred in their daily life, they feel tired of, they feel fearful, and they feel tension about this type of situations and this type of objects occurred in their daily life. Fourth one is panic disorder. In case of panic disorder, the patients are very much panic about their health conditions. They feel they are unable to do anything, they are unable to do the daily lifestyle, they are unable to do the physical activities, physically they are feeling tired, so that's why they feel the panic disorders. In case of panic disorders, the persons are attacked by the anxiety attacks with the passage of time. Multiple times they feel anxiety attacks, and in this situation they feel shortness of breath and chest pain, dizziness, and precipitation from whole body. So that's why they feel that they are at the risk of death, so which may be lead to the panic disorder. Panic disorder is if the person feels almost of 1 month anxiety disorder, then it would be of panic disorder type. Fifth one, obsessive compulsive disorder. Obsessive compulsive disorder. In this type, the person is very obsessive about some conditions, some situations, some thoughts. These thoughts, these fears, these conditions come into the mind the whole day or multiple times come into the mind, which leads to the fearful environment for that persons. In this way, they feel for this problem to be persisted more than 1 month, it would be lead towards the obsessive compulsive disorder of anxiety. In this situation, the persons are very panic, very obsessive about that situations and about that problems. Last one type, last one type is the post traumatic stress disorder. Post traumatic stress disorder. This is related to any type of trauma. Any type of traumatic event like war, like accident, disaster, and upsetting problems which are occurred during the life of the persons. If they are out of the mind, they become back of their mind. These events are repeated and repeated, and flashbacks of these events are comes into the mind of that persons, which causes the many type of dispersers and fears and worries in the mind of that persons, which leads to the post-traumatic stress disorder. It leads about 6 months to 1 year, and it depends upon the conditions about to be set out, and the person comes from that come back from this trauma, then they can be come from this type of anxiety disorders. These are about the types of different anxiety disorders. You should know every problem, every disorder, every disease can be lead to anxiety due to the health conditions, due to the different types of drugs which are given to the patients, may also be lead towards the anxiety and depression in the mind of that persons. And they may be feel that they would be die, they would be not be better, and if we provide them the better health conditions, then they comes from that anxiety disorders. First of all, the anxiety is not a very fatal disease. It is not a fatal disease. It is only a disorder which is related to other diseases. So it can be overcome by avoiding these situations. First of all, you should have try in your mind. You come from the different type of phobia which comes to your mind, which comes to that patients. It should be by the social behaviors changing, by the social behavior changes, by changing the condition of that person, by changing the environment of that person, they can become out of this anxiety disorder. But let's we discuss first of all the treatments which are given to the anxiety disorder patients. Treatments. First of all is the social treatment. If the doctors and if the persons talk with anxiety disorder patients and come to socially, emotionally setting with them and sitting with them and talking about the problem. The problem is coming out of the mind, and if this situation is controlled by regulating them, if they have problem with certain type of situations, the person should treat them to come out of these situations. And social behavior, if you feel them to be proud, to be that you are not to be humiliated, you are not to be insulted in any type of way, and if give them respect about many type of problems, then they can become out of this anxiety disorder. And also if patient patient maybe it by itself can become from this type of anxiety disorder. if he feel free, he feel to take a walk during this type of trauma. By walking in the walking towards the environmental stress would become, and this stress should be overcome by taking a walk, by taking a bath, by taking a rest, by taking a healthy sleep, by taking healthy foods. It can also be controlled. So these all are the social treatments which given to the anxiety disorder patients. And by doing these all activities, they can come from these anxiety attacks. Second is drug treatment. Any type of antidepressant medicines are used for the control of anxiety disorders. Antidepressant medicines, which are the benzodiazepines, which are used to control these anxiety disorders, these are actually they are the medicines which are bind with the neurotransmitters and control the level of hormones which are related to the mood and behavior situation of the persons. And by improving these hormones, these patients can come from this anxiety disorder. Many different types of drugs are available in the market to control these anxiety attacks, and the duration and the amount of this drug is as prescribed by the doctor towards the situation of that anxiety disorder persons. Benzodiazepines are the drugs which are used as anti-anxiety drugs. Lexapro, Paxil, Celexa, and so on. Many of the drugs which can be used to cure this anxiety disorder. After these treatments, the third treatment is natural remedies. Different types of natural remedies can also be used to control these anxiety attacks. For example, green tea. Green tea extract is very helpful to control this anxiety disorder. It contains a antioxidant activity which causes to be enhance the GABA receptor, the neurotransmitter in the body of patients, and by increasing this by increasing this antioxidant, the serotonin level is increased between the body, and it leads towards the outcome of anxiety attacks. Other than green tea, different types of nuts like almonds, yogurt, yogurt related products, pumpkin, seeds, bananas, fish, egg yolk, these are all the natural remedies which can be used to control these anxiety disorders. Yogurt also contains the antioxidative activity. Pumpkin seeds contains the high selenium levels. Bananas contains the high magnesium levels. Fish contains the omega-3 fatty acids, which can lower down the situation of fear, and it controls the mood situations, and also increase the level of serotonin within the body, which can lead to the outcome of this anxiety disorder. Turmeric, camoline, chocolates, dark chocolates are also rich in selenium, magnesium, and zinc ions, which can be lead to come these anxiety disorders. These all are the natural remedies which can be used to overcome this anxiety disorder. And also, how can we avoid this situation of anxiety disorder? Let's see how we can avoid this anxiety disorder situation. We can avoid this anxiety disorder situation by avoiding the large amount of caffeine, nicotine, drinking, alcohol drinks, and even soft drinks can also be cause anxiety. So if we lower down the amount of use of caffeine, nicotine, soft drinks, and alcohols, and we take a regular walk, we take a healthy sleep, we stop smoking, we stop unhealthy foods, and if we take healthy diets which contains the vitamins, proteins, carbohydrates, and lipids in their regular amounts, then we can avoid this anxiety. In the last, we talk about the biochemistry behind this anxiety disorder. When there is a disorder, there is something to be more within the body created, or something is lower down within the body which can cause these disorders. So in case of anxiety, the serotonin is actually a neurotransmitter. If its level lower down within the body, it causes the changes in the behavior of the person, the memory loss, the mood swings, and the sleeping disorders. These all things are cause the anxiety in the patients. And if we choose different types of medicines, or if we choose any type of natural remedies, these are leads to enhance the serotonin level between the body, which can lead to overcome this anxiety situation. Second important thing is the GABA receptor between the body. This GABA receptor is also related to serotonin level. If serotonin is bind to this GABA receptor, and similarly the drugs which are used to treat these anxiety disorders are also bind with this GABA receptor and increase the level of serotonin between the body. When the serotonin level between the body is increased, the body leads towards the healthy condition and the anxiety attack should be lower down. Third one, the thyroid hormone. If the patient feel any type of thyroid gland disorder and the level of thyroid hormone is increased between the patient's body, then it may also be lead towards the anxiety disorder. And this can also be overcome by using different types of neurotransmitters for increasing the level of serotonin between the body. Similarly, norepinephrine. If the level of norepinephrine between the body is high, it can also lead towards the mood swings. It can change the mood. The persons feel sad in their mood. They feel fears. They feel worries. They feel stressful. So they all are leading towards the anxiety disorders. And if the norepinephrine level is lower down by using different types of drugs and by using different types of natural remedies, then this situation is overcome and the anxiety disorder can be lower down. Last one is the dopamine level. Dopamine is also a neurotransmitter. Its level lower down during the anxiety disorder. If we use different types of drugs and different types of natural remedies to increase this dopamine level, which can lead to the serotonin level increase, then we can come out of these anxiety attacks, anxiety disorders. These are about the biochemistry of the body which is changed during the anxiety disorders. Mainly I talk about different hormones, different neurotransmitters which are either increased within the body or either decreased within the body during this situation. These can be changed by using different types of drugs. But we say also that the different drugs taken during the other disorders, like in diabetes, in cancer, or any other disorders, any other diseases, these can also be leading towards the disturbance of these hormones and these neurotransmitters within the body, and it leads towards the anxiety disorder. This is not persisted for long life. It can be overcome by normal changes in their daily life, by taking healthy food, by taking healthy exercise, by taking bath, by taking from our mind to come these situations which cause the fear and stress in the mind can be avoided the anxiety. But this situation may be of a few hours, it may be of a few days, or it may be leads to months or years, depending upon the situations present within the life of that patient. So by changing the social behaviors, by changing the environment, it can be overcome. And also by reducing the use of type of depressive situations by reducing the use of caffeine, by reducing the use of soft drinks, nicotines, and by taking the healthy sleep leads towards the awareness of these anxiety disorders. This is all about the anxiety disorder lecture. I think so you have an idea about the anxiety disorder. If you have any questions regarding this lecture and regarding this disorder, you can comment me, uh, uh, and I will try to my best to answer these questions. So thank you so very much for giving me time.